So for this video, I'm going to be showing off a couple different tests to look for any SI joint dysfunction. I'm going to do the Thomas test, the sacral thrust and Gienzin's test, the supine long sit, and then a muscle energy for a left anterior, right posterior girdle. So for the Thomas test, it's rather simple. I just lift the patient into passive hip flexion, and then I'm looking at the opposite lower extremity, checking for some flexion there. It's a positive or negative, either there's some or none. And it's looking like with the Thomas test that there's no repeated flexion on the opposite hip. Now in this position, I can also do the Gienzin's test, where I would keep one hip in flexion and then press the other one passively into extension, and I'd be checking for any symptom provocation. Any pain?
A little bit.
A little bit?
I want it back.
On your back. And that was the Thomas and then the Gienzin test. So next, with the sacral thrust, I'm going to ask the patient to lie sideline towards me. So turn towards me. And this one you get real up close and personal. What I'm going to do is lift from the sacrum. I'm going to put my hand on the lowermost part of the sacrum, and then probably be better if I did it like this. And then I'll have the patient return to supine, so lay on your back again. And then with my hand on his sacrum, I just push down, checking for any symptom provocation. And that's the sacral thrust test. For the supine long sit, I'll have my patient I'll feel for his medial malleoli, and it looks like his right is a little bit longer down than his left, so there could be some posterior tightness on this SI joint, or maybe some anterior tightness on this joint. I'm going to use his left as a reference. Yeah, go ahead and grab my hand. Come on up. And then it looks like that distance actually went a little bit closer down to normal. So it could be a posterior tightness on this capsule, and this SI joint is just fine. And that's the supine long test. Now lastly, get my dog out of the way. I'm going to show a muscle technique for a left anterior, right posterior pelvis. So go ahead and lie down again. So with a left anterior, right posterior pelvic girdle shape, it could be that his extensors on his left are weak and his flexors on his right are weak. So what I can have the patient do is I can bring him up a little bit into flexion. Well, I guess that's happening. And then I will ask the patient to bring this knee up for me a little bit. Okay, good. Now relax. And then for the anterior tightness, I'm going to have him drive his knee into the table. Okay. Now bring those two movements together. So drive this knee up, push that knee down, and that should fix the right posterior SI joint and the left anterior SI joint. And those are the different SI joint tests.